Well, I'm going to talk about what I think is a very delicate topic when it comes to child sexual abuse, and that's the issue of boys who are sexually abused who then go on to become abusers themselves. I'm going to do that by showing you a small taped vignette that I made actually about 32 years ago of a man who himself was victimized by his father. His father not only sexually assaulted him, but he was present with his father when his father would sexually assault other women. And this has been documented. He was clearly the victim of substantial abuse. And then he went on to become a victimizer, actually a serial rapist, the kind of person that would often be referred to as a sexual predator. Now, I very much support the approach of public health to looking at this in terms of the big picture, and I'm going to come back to that after I show you this vignette. But one of my primary mentors, Paul McHugh, who was the chairman of the Department of Psychiatry and Behavioral Sciences for many years at Hopkins, cautioned that if you're going to do research in any area, whether it's schizophrenia, bipolar disorder, autism, anorexia nervosa, it's very important that you see the conditions for yourself and that you see the people that have them. And so I want to get from the big picture here into the microscope and show you one example of a boy who was abused who became an abuser. And then I'm going to come back after I present that to make some points that I think are important in terms of prevention and the work that's done here at the Moore Center. To lay a brief foundation before I show you the film vignette, I just want to make 3 or 4 preliminary comments about, I think, some concepts that I think are important to understand. The first one is going to be how do we determine whether there is a relationship between being a victim and becoming an offender. And it's particularly important in this area where there's so much emotion and sadness and trauma. There are folks, when they hear about victimizers having been victims, they're fearing they're making an excuse, which is not what we want to do. But how do we make a determination whether that relationship is there? When I talk about this, I often talk first about the relationship between cigarette smoking and lung cancer, and then I'll make it clear why that's relevant here. If you look at everyone that smokes cigarettes and ask whether or not most of them develop lung cancer, if we don't remember this, it's important to think about it. The facts are that most cigarette smokers simply do not develop lung cancer. And if we stop there, we might think there's not much of an association. On the other hand, if you then take a group of people with lung cancer and ask how many of them are cigarette smokers, the overwhelming majority, particularly with the most common form of lung cancer, are smokers, so that when you put it all together, it's very clear that cigarette smoking is a significant risk factor for the development of lung cancer. Why some smokers are not damaged by the experience in a way that causes lung cancer is very important for us to learn more about, but the fact that some weren't damaged that way doesn't constitute evidence that others weren't indeed so damaged. Now, to bring it over to this area, if you look at a large group of children who've been sexually abused, the good news, and thank God this is the case, and particularly if they get help early on, is that the overwhelming majority of victims of child sexual abuse do not go on to become victimizers. On the other hand, to follow up on the analogy I just gave you, if you look at a large group of individuals who are sexual offenders and ask what percentage of them have been sexually or even physically and emotionally abused, the numbers become extremely significant. And so again, when you put it all together statistically, there is no doubt that being the victim of child sexual abuse is, in my judgment, a risk factor for becoming a sex offender. Why some people weren't damaged in that way and predisposed to become sex offenders, we would like to learn more about, particularly in terms of prevention. But the fact that some boys, that's what we're going to be talking about here, weren't damaged in that way does not constitute evidence that others were not indeed so damaged. Now, the second conceptual point I want to make, because I said that this man became a serial rapist, is to say a couple of words about rape, because I think there's tremendous misunderstanding about rape, and we often talk about it as though it's just one thing. When a clinician such as myself looks at rape, we look at it from 3 perspectives. One, the behavior itself. Secondly, the consequences of the behavior. And thirdly, the motivation that led the individual to act that way in the first place. Now, in terms of behavior itself, rape indeed is always the same thing. It's one individual coercing another against their will into sexual activity. And again, when it comes to the consequences of rape, Again, I'd argue it's pretty much the same thing. It's experienced by the victim as a horrible, unwanted, traumatic experience. But I'll put it to you that in knowing the behavior and knowing the consequences, we still don't necessarily know what motivated the particular individual to engage in that behavior in the first place. And what we've learned by studying such individuals is there are many motivations. There are some people who are simply angry and ventilating their anger by taking it out on an innocent person. There's some people who are simply sociopathic. They lack a sense of conscience and moral responsibility. A man who breaks into a house looking to steal something, finds a woman home alone, and exploits the situation. But there are a subgroup. There's many other categories, but the one I want to focus on here, there are a subgroup of rapists who are predisposed to engage in that activity because there's something fundamentally different about their sexual makeup. They are sexually disordered. And one of the ways in which a person can be sexually disordered, and I think it applies here, is that they've been the victim of child sexual abuse. Now, that's the next concept I want to get over to you is what is a sexual disorder? If you look at the Diagnostic and Statistical Manual of Mental Disorder for the primary mental characteristics of any sexual disorder, it will say that the individual with the condition experiences intense, recurrent, sexually arousing fantasies and urges about something, and depending on the particular type of sexual disorder, that something in pedophilia would be children, in exhibitionism about exposing oneself, and in the case of the individual I'm going to present here, about raping. Now, again, to make sure I'm crystal clear, the average man presumably is physically capable of committing a rape, but it would be ludicrous to suggest that the average man experiences intense, recurrent, sexually arousing fantasies and urges about raping to the point where it's an ongoing struggle not to do so. This man I'm going to show you is a sexually disordered sex offender. I believe his sexual development was warped by his own abuse, and you're going to see an example of what that means in what I'm going to show you here in a couple of minutes. By the way, I don't think that should surprise us. You know, if I give cocaine to a young child, I'm certainly not surprised that they have drug cravings and a drug problem when they're older. If we introduce a young boy into sexual activity very much prematurely when he's not equipped to handle it, should we be surprised that as an adult he may still be struggling in the sexual arena? I might also add, because in terms of what you're about to see here, it's not just a lust to engage in sexual activity this man is going to describe. One of my other mentors who's passed away, Dr. John Money, coined the term love map. He talked about how people can have a distorted idea or distorted thoughts about what love means. And again, in this young man who was sexually abused himself, I think you'll see not only is he having these urges to rape, but the way in which he thinks about sex and about rape, as much as it doesn't make sense logically, incorporates feelings of wanting to be loved into it. And so I wanted to give you that as a preliminary comment. The last thing I'll make, and I'm going to save the rest of my comments for after you've seen this little vignette, but it's important in terms of prevention, even though it's a bit of an aside. This gentleman's going to talk about a medication that is reducing the intensity of his sexual urges, the frequency of his sexual preoccupations, and that goes beyond the scope of what I want to talk about here. In fact, the medicine we use today, 32 years later, is not even the same medicine he's talking about. But the point I do want to make, because we're all concerned about prevention, is that in Maryland, anyone who has Maryland-supported insurance can get this type of medication, in part because the program here at Hopkins exists and the people who've made these policy decisions in Maryland make it available. I get letters from people around the country, offenders, wanting access to this medication, a medicine that cannot make the community less safe, one that if it helps them to be better in control of themselves can only enhance community safety. In most parts of the country, even though this could be a preventative measure in my judgment that would help make the community safer, most of these individuals have no way of accessing the medicine, even though they want to have access to it. So with that as a preliminary, and I'll give you a follow-up. I said it's been 32 years of where this fellow is and what's happened since. Let me show you the vignette, and then I'll save the remainder of my comments for afterwards. And hopefully I'm technologically sophisticated enough to push one button, which I've done. So I don't see anything happening. So let's see if there's something more I should be doing. Maybe try this one. Thanks.
would just drive around, park, and my father would want to have sex with the woman. And with me being in the car, the woman would be reluctant. If I wasn't there, I think the woman would have actually been willing to have sex with. But with me there, she was reluctant to have sex with my father. So he would smack her, and it would be a rape. And I'd watch this.
So when you were young, your father actually introduced you into the idea of forcing women into having sex and didn't teach you that it was wrong. But as you grew up, somewhere along the line, you must have begun to realize that these ideas were unique to your father and that it was wrong. But what then?
When I was 16, I didn't know that rape was wrong. As a matter of fact, until I was arrested, I didn't know rape. I didn't know that what I was doing was actually rape.
I don't understand that.
Well, I grew up with my father, okay? After the separation, especially after the separation my mother and father had, I went with my father. Everything that my father did, I wanted to be like him, right? Everything he did, it was okay with me. I mean, even when he molested me, all right, that was okay with me, all right? When I was 16 years old, my father raped my girlfriend. I knew that was wrong. That was the first time that I actually knew that what was going on was wrong. And between the ages of 16 and 18, that's when I really found out that what I had been doing was wrong, but I still couldn't stop that. I would always fantasize about a perfect relationship, about a woman loving me, sharing with me, me loving her and sharing with her, just a perfect relationship. But it was that way in my mind. But when it came to having sex, it was always in the form of rape. And, I look back over my life now, and I have to relate that to, the way I did grow up with my father. When I was a youngster, I didn't feel that I was loved. Love wasn't taught in my family. I didn't feel that I could love. I didn't know what it was. But, my fantasy of it was just a perfect relationship. Books that I've seen watching television, the soap operas and stuff like that. But the fantasy part of it came in.
You need to explain something to me. Sorry to interrupt, but you're talking about love, something that most people think involves affection and companionship, intimate,
right.
soft, gentle, caring feelings, and you're talking about that in the context of rape. Explain to me how those things fit together.
Well, in my fantasies, like I said about the relationship with the women in my fantasies, I would actually want a relationship with the victim. I really would. And when I would get a victim, it was just, she became a part of that fantasy. I mean, she really became a part of it. And I would want that relationship with her. I'd want her to care for me. I'd want her to love me. I wanted her to be that person in my fantasy. I'd want that. And even after some of the victims that I raped, I wrote them letters. I made phone calls to them. I asked them how they were.
I mean, to taunt them, or why would to taunt them?
No, not to taunt them. No.
Why?
Because I cared about them. I cared about the victims. I do believe that there are people that goes around out there and rapes just for the hell of it. But I'm not that type of a rapist.
And again, then, I want to be clear. You would threaten some of these women with a knife. You must have terrorized them. And you're telling me that you had hoped in your mind that the end result of all that would be that they'd care about you, that they'd love you?
Yes. I would write them. I would call them. And, on one occasion, I did date a victim again. I have a daughter that's 15 years old. And I haven't seen her for 13 years. And, one day, when she's old enough, I have to get on this.
It's important.
One day, she's going to be old enough when she's going to want to see her father. And I've been in jail all of her life. So every birthday, every Christmas, I'd put a card in there. I'd write her letters. I'd let her know that I loved her and thought of her. And that was the diary that I kept.
and I still keep that.
You never mailed them to her. You wrote
I
them
didn't know
and
where
put
she
them in the
was at.
diary.
I didn't know where she was at.
How would you explain to her when she's older, if she contacts you, how you were raping other people's daughters?
At that time, I didn't know. I didn't know at that time why. I really didn't. I know that I just knew that I had a problem, and I knew it was. I really knew it came from these fantasies, and I also thought it came from my father, because I'd been seen by a psychiatrist before, and he said that I'd do these things because I had been predisposed to these sexual crimes by my father before. But they didn't want to hear that. Every time I told them that, they said, that's bullshit. You rape because you hate women. And I didn't know why. So I can't sit here and tell you or anybody else, I didn't know I wouldn't have known if my daughter was to come to see me at Patuxent. I wouldn't have known what to say to her.
What would you say to her now?
Well, now, I'm on the medication. And I don't have the urges to rape. I have, the medication gives me time to really look at me. Before, I was just completely lost in that world of fantasy, that sexual fantasy. And now I have a chance to look at myself. And I do know that how I grew up played a major part in why I raped. I didn't know about testosterone. I didn't know what testosterone was. I got a high testosterone level that, that has a little part to play in it also. The way my father taught me how to view women, that had a part. And then there's an excitement level, because when I was with my father and he would rape, I was very excited about that. I mean, the level of excitement was extremely high. It was so high where I would actually, for just a couple seconds, just like lose my breath. And I could sit down and explain it to her, just like my daughter Stephanie. I did day before yesterday.
Do you love your children?
I love them very much.
What you said you didn't hate your victims. Suppose you could have one of them here now. What would you want to say? I know they might not want to listen. They might not care. But what do you wish you could help them to understand?
The biggest part, I'd like for them to be able to understand why I had to do that to them, and maybe some way that they could forgive me for it, that they could really understand that I didn't rape them because I hated them. I didn't rape them because I wanted to hurt them or humiliate them. I was looking for affection. I was looking for love, and I couldn't control the urge. And then again, I would say I'm sorry, but to me that's not enough. I seen my daughter for the first time in 3 years, day before yesterday, and I seen all the love. I seen what I missed, and it hurts bad.
I want to talk a little bit about what you're doing to change and the treatment you've been receiving. I know you didn't want to rape. I know you're hoping that maybe you got this life sentence, that you'll be able to prove things are different in the future. Can you tell us a little bit about what you're doing now and what's different now to try and help change things?
When I'm on this medication, this Depo-Provera. When I got light back up again, and I said I was relieved, but I didn't think there was any hope. I'd been in jail, been out of jail, been in jail, been out of jail for the same things. I just didn't think there was any cure. I didn't think there was any hope. And a psychologist down at the county jail, she told my family about this program that John Hopkins had. So I got a court order and went to the Phipps Clinic. And there I had an evaluation done, blood taken and stuff. And you told me, and the staff, the other people that was there, they said that they felt that they had a medication that could help me control my desires, my urges, this compulsion to rape. So I thought at first it was a lot of crap. And so I didn't trust doctors very well because I've been lied to. I tried trusting them. I let people come into my life and then they'd just leave. I was tired of that. But after about 5 shots of the Depo-Provera, I noticed that I couldn't get an erection like I used to. Then I didn't have the thoughts of the fantasies. I didn't have the urge to rape. I didn't have that. And then you told me that I could have a normal sex life with my wife. And I kept on wondering why in the hell he told me that and I can't even get an erection. But later on, the way the medicine has worked for me is that, I found out that I could get an erection with thoughts of a person that I was I really cared for and loved, and my wife. And that's it. But the medication took away all the fantasies that I was preoccupied with, the urge to rape, the masturbation, and it gave me a chance to really look inside of me. And it was a whole new set of feelings. I can appreciate a woman. I can sit and look at a woman. I can talk with women. I can appreciate them as people, as human beings. I can look back and see that everything what I've done has been wrong in regards to that, my sexual behavior. It's just a whole brand new ballgame. And it's just changed me as a person.
As I said, this was a film I made 32 years ago. He is still in prison. I doubt very much he'll ever get out, but he has stayed in touch with me. And I guess it was about 6 months ago that he invited myself and my wife to come to a prison function, and we accepted that and went there. One of the things that shocked me quite a bit is that one of the people who was there visiting him was someone who years ago he had victimized. She'd initially gone in there to confront him. She thought maybe she'd get some closure. She wanted to ventilate about how horribly her life had been affected. And over the course of these 3 decades in getting to know him, she began, of course, not to get over the regret of what had happened, but to see him as a person, and clearly now visits him regularly and has turned out to be a supporter. She has a husband, she has a family, but she continues to be supportive of him. What are the points I want to make here? It's such a short period of time. There's really just, I think, a couple. One is, I do believe this is a tragic example of what can happen to a boy who's been abused, and both emotionally and sexually, and where that's not recognized early on. One case, of course, doesn't provide compelling proof, but I doubt very much that he had a different type of a childhood that this would have happened. And given that he did have it, what a waste of his life. Children who are deprived of parents, all the women who were victimized by him, just a terrible tragedy. And again, in terms of the points I want to make here, could it have been prevented? And this is what I want to stop with. I believe right now, as I stand here, there are large numbers of young people out there who are privately aware that they're having atypical kinds of sexual desires. We'll hear this afternoon about individuals who, as adults, are sexually attracted to minors. There are individuals out there like this individual who know that they're having fantasies and urges to rape. There's individuals out there who are worried, young people, 16, 17-year-olds, that they're not sure they can control themselves sexually. In terms of outreach by the mental health community, the public health sector, we hear frequently advertisements, public service announcements. If you have schizophrenia, if you have anorexia, if you have a drug problem, if you're having family difficulties, for goodness sakes, please come in. We have help. We want to assist you. I'd put it to you, when is the last time any of us ever heard announcements saying, if you're a troubled adolescent, if you're having disturbing sexual thoughts, if you're concerned that you're going to lose control and hurt other people and ruin your own lives, please come in here before you cross the line. We want to help you. We want you to have a life. We want to prevent others from being endangered. We've heard it over and over here today. We pick up the pieces after the fact. We hardly ever do anything to try to intercede before the fact. I'm so proud to be a part of the Moore Center here. I think that's exactly what we want to now try to do, to see this as a public health issue. We're not decriminalizing, just as with drug and alcoholism. We want to fully support the criminal justice sector, but we've given so much lip service to prevention, to seeing these issues as a public health matter. I think that the work here is going to lead the way over the next few decades. Again, I'm very proud to be part of it, and I thank you very much for your attention.